If there was ever a hospital put together right from the beginning, it was community. The medical staff was dedicated, the board was dedicated, the employees were dedicated to community.
The nickels and dimes from people in the community and some business people and doctors, they just wanted to care for patients.
Our guests are people with names, health problems, and personal problems, and they have anxious and concerned relatives and friends. They are not to be considered as numbers or disease entities, but as individuals.
I've learned from the ones I knew, two of the three before me, the sense of community, small c community, the sense of partnership, the sense of teamwork. Our relationship with our physicians, I honestly believe is superb to any other place that I've been. There's an inherent trust that people are going to work for common good, not work for self-interest.
Physician relationship was outstanding the whole while I was there. We had a great nursing department, always have had.
Nurses are the people who are around the patient longer than anybody. Nursing care is very important. When you look at who people respect, it's nurses that are on the top of that list.
Sometimes it takes the disposition of a saint and the patience of Job to deal with people in crises.
Everybody in the institution is valuable, particularly those people who are closest to the patient. And that's what community was built on.
The North, I knew someday would be the key hospital because of the location.
I think his most important contribution was realizing that because Indianapolis is a quadrant city, we needed to be at least on the north side. I said, gosh, we're on the east side, we're on the north side. It would be great to be on the south side. We felt we needed to develop a system of care rather than just hospitals.
I think the idea of being willing to grow and at the same time not turn our back on our mission and our heritage. I still believe that everybody should have access to health care. Community should be the easiest place to access and the easiest place to get through.
We get a lot of letters from people who thank us for having treated them as individuals, kindly and sympathetically. That is our goal.
We want it to be a nice place to work, a good place to work. We work pretty hard at that.
I always said to people, we don't have to be the biggest. I just want to be the best at getting better all the time. If we can be the best at getting better, we'll be fine.
Community's always been an organization that is surrounded by people who like working together and working within communities. When we work together as one in a unified way, then we are really community. And I think that's true in '54, and I think it's true in 2018.